So what is this link between influenza, infection, and stroke?
Yeah, I didn't know about this either until last year, but it turns out that after flu season, about 3 or 4 weeks later, there is a stroke season. And like you said, most of Canada is getting down off of a big hump of flu. So now we're starting to see more strokes. And a friend of one of my colleagues actually mentioned that at work the other day. Said, have you noticed how many strokes we're seeing? It's a lot more than usual, it feels like. So anecdotally, we're starting to see that. The good news is that getting your flu shot reduces your risk of stroke, according to a study from the University of Calgary right here back in November.
Tell us more about that study.
Yeah, so the researchers looked at health records of all Albertans, so about 4 million people over 10 flu seasons. And they found that for about 6 months after you get your flu shot, the risk of having a stroke is reduced by about 20% overall compared to if you didn't get a flu shot. And your risk goes down even if you don't have the sort of typical stroke risk factors like being over 50 or smoking, things like that. Even for younger folks, the risk is lower if you get a flu shot. And it's even lower if everybody gets their flu shots year after year after year, rather than just a single flu shot.
I'm hearing a theme here. We should get our flu shot. Let's back up for a second. Can you explain what a stroke is and how getting a flu shot would lower the risk of having one?
Yeah, so a stroke is when the blood supply to the brain is compromised for some reason. It's basically a plumbing problem in the pipes that supply blood to your brain. And there's two things that can go wrong with pipes, right? They can get blocked or they can burst. So either way, the blood can't get to where it needs to go. And if the blood supply isn't restored quite quickly, like within a few hours, then parts of the brain start to die. And the symptoms are a bit different depending on which parts of the brain are involved. So as for how a flu shot might lower your risk, we know that when your body fights a big infection like influenza, there's a sort of a system-wide inflammatory response. And that inflammation can cause problems with the pipes. It can make the inside of the pipes stickier. It can make your blood a little bit thicker, especially if you get dehydrated. And it can even put the heart into a weird rhythm called atrial fibrillation. All of those things can increase your risk of having a stroke. So by getting a flu shot and then avoiding having influenza, you basically avoid the risk of all that inflammation. And even if you get your flu shot and then catch influenza still, you still have way less inflammation because your immune system is already ready to fight. So that's sort of how the flu shot eventually lowers your risk of stroke is by either preventing the inflammation from the infection or decreasing it overall.
As we mentioned, the infection rate for flu is waning a bit. Is it still worth getting a flu shot at this point in the season?
Oh yeah, absolutely. So it's not too late, partly because, if you think of a slope, you get about half the people get the flu, and on the upswing of the slope, and then we hit the peak, and then still about half the people will get an infection on the downslope of the peak of flu.
Okay.
The other thing is that we've seen one wave of flu so far due to H3N2. We might be seeing another wave eventually, maybe due to H1N1, a different strain of flu that goes around.
Oh, goody. Let's return to the stroke and end on that note. How would a person know, Dr. Raj, if they or someone around them is having a stroke?
So a couple of things to remember. If you remember the word FAST, that's an acronym that people have come up with. F stands for face. So if your face is droopy on one side all of a sudden. A is arms. So if suddenly one arm is weaker than the other. S is speech, so suddenly you're not able to speak properly, you're slurring your words, things like that. And T stands for time. If you see any of those things, it's time to call 911 because speed is of the essence here. Now there can be other signs as well, like sudden confusion, sudden dizziness, things like that. But the thing to remember is that even if those symptoms go away quite quickly, it's still time to call 911. You can get what some people call a mini stroke. I don't like the term mini stroke because it makes people think that it's always just a little bit of your brain. It can be a large part of your brain. The mini that people think about with a mini stroke is that the symptoms don't last that long. So mini is referring to the time. It's kind of like a pipe that gets plugged and then sort of unplugs itself, like when you flush a toilet and it's just about to overflow, but then it doesn't overflow. So that sort of similar transient blockage in a pipe can cause these things called transient ischemic attacks, or these little mini strokes. And those are still dangerous because about 15% of strokes will have a mini stroke beforehand.
Thanks, Dr. Raj. We're up in terms of our time together, but always a pleasure.
Thanks, Rob.